Okay, let's call the August meeting, excuse me. Joe, excuse me. Let's call the August meeting. Human Services order.
I think there's more than one. That's okay. Thank you.
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Good. Agenda items.
Would you like roll call? Dale Schleter,
Here.
Tweet Schuman,
Here.
Dale Olson, Chuck Van Etten, Don Pettit,
Here.
Lorraine Gouget,
Here.
Jennifer Bokornik, Carol Pearson, here, Sabrina Dunlap. Here, you have a quorum.
Good. Now the meeting agenda. Changes. Move on to public comments. Invite the public who wishes to be heard. Please come forward, state your names. And your name. Last month's minutes.
I'll make a motion to approve as presented, Mr. Chairman.
Motion.
Everybody in favor, say aye.
Aye.
I can, I can't hear. It's too soft. I don't know if the microphones need to be closer. I did not hear Dale or at all.
I will try to speak louder.
Can't hear. No, okay. They can't hear back here at all either.
Can you hear me now?
I can.
Committee reports.
I have, I wanted to update on, can you hear me? Can you guys?
Yeah.
The LCO community currently has 18 active cases of COVID-19. All contact tracing and quarantine is in place. 10 of these patients will be coming off the list by this Friday. These numbers reflect a recent small surge in positive cases. Small surges can be expected as a significant number of community members are still unvaccinated. We have not had a positive case in 4 days. 95% of the recent cases were from unvaccinated patients. The small percentage of patients whom are vaccinated but have been tested positive for COVID-19 are reporting less significant symptoms of COVID-19, which indicated the vaccines are working. The LCO Health Center has 1,200 vaccines on hand. Anyone wanting to get vaccinated can call the Health Center at 715-638-5100, and they will be scheduled for vaccination as soon as possible. We expect FDA approval in the near future for Pfizer booster doses for those patients over 60 or with comorbidity. In order to protect our community, please consider getting vaccinated today. The life you may save can be your own or a member of your family or a friend. In response to this, we will be opening a respiratory urgent care clinic at LCO Community Health Center beginning August 16th, 21. All possibly contagious patients will be seen at the urgent care elder care entrance from 8 a.m. to 4:30 p.m. This is being done to enable the health center to see all of our normal healthcare patients in a safe manner during the upcoming winter months. This will be bio appointments or via appointments or walk-in if you have any respiratory illness, sore throat, cough, fever, runny nose, etc., and think you may need to be treated or tested. We will be able to segregate this population from the health center. As tribal leaders, we are now looking at updating our policies and the changes that we'll be making for the community and how we can protect our people. So we are going to be making some changes as soon as we get a completed update and how we are going to move forward. And highly recommend as many of our people get vaccinated. We are seeing some of our people who are throughout the country that we've lost recently. What we're seeing is they were not vaccinated. A couple were in Florida, a couple were out west, some of our people, and we are seeing those results. So we are watching the pandemic. We're trying to protect our community and our children. The schools are going to be opening with their masks in place, and continuing to encourage all our people that are at the appropriate ages that can be vaccinated to continue to vaccinate as many of our people. So that we are continuing to work on. Our daycare center now, I believe last I spoke to our director, we were like 60 children. So our programming is coming into place, and we are having little bumps along the way, but we're working through that. And we're going to continue to grow at this time as we are progressing in that direction. So that's a good thing. Our men's shelter, I think, is our capacity right now, 13, 14 men, and we want to continue to take care of our men who are homeless and have that need support. The women's shelter now is open, so we have our women and children able to come to our facility. So now we're up and running with that part. And the domestic shelter piece has their facility all up to date and operating. So we're continuing to provide those services. Our treatment, we got our MAT program. And I think within the last numbers I heard there, we had like 60 patients, 65. And we had another addiction specialist come on board, and we're going to continue to try to help meet that need there. And again, send our people to treatment or any facility that they might need help with. We are in the process as a tribe trying to, the monies that are being funneled down to us now, trying to plan on what we can do for our community to build on what our needs are, and to try to be wise in what we need for the future. So, I don't know, Tweet, if you want to add anything?
No, just that we continue to have weekly American Rescue Plan meetings regarding the money the tribe got. So that's all I have.
Mhm.
Ms. Pettit, go ahead.
Yes, Miss Lorraine, Miss Goudet, can you email me the stats regarding the respiratory clinic and the opening? I wrote it down, but so I have it so we can get it posted out at the college for the community. Also, have you had, I'm well aware that there are individuals that are fully vaccinated that have come down with serious respiratory illnesses that have been fully vaccinated within our area. So that's the other thing we need to consider.
Mhm.
But if you could get that to me so I can get it out on our Facebook and at social media, because the college is involved in the college vaccine challenge to vax up. And I believe we're going to have some clinics. They're supposed to correspond with LCO and the county and try to do a flu shot and vaccine clinic so we can get more of the demographic, the 18 to 25 and maybe to 30 vaccinated at the college also, because we've discussed our plan today and it's going into effect that we're going to be masking up, and there'll be some other restrictions. But one of the questions that came forward was, does the tribal governing board, have they ever revoked the masking mandate that was on the reservation? Because that's a question that we have gotten, and when you call, we're told that there is still a masking mandate. It was never revoked. Because some departments wear masks, some do not.
We were debating on certain things because things were improving and things were getting better in the community, and more people were getting vaccinated at a certain point, but not everybody. And we made it to where those who were vaccinated did not have to wear their mask, but those who were not vaccinated had to continue to wear their mask. So, and I know that's hard to determine at times when you are in the public and when you're in a setting you don't really know, but that's where we were at. Now we're leaning more towards mandating.
I guess my question would be is that there was nothing that I have seen that came across through from the tribal governing board revoking it and making that statement. No one, if you call the governing board office, it's saying there's a masking mandate still in place, that there was no was no release of any publication or change to the mandate by the LCO tribal governing board. So that's where I'm getting at, is that there's confusion within the community on what's going on. So if it did change, we've never seen anything, and it would be helpful so we could get out to the community too, and we're all on the same page.
Yep, and we are highly recommending it. But yeah, we will get that to you. And then I'll have to email that to you, Don. Okay?
That's fine. Thank you very much, my dear. I appreciate it.
Yep, you're welcome.
Do you want to say something?
No, that's good.
Okay. Any other questions for Lorraine? Okay, Joy Johnson for the Senior Resource Center. Joy, are you there?
I'm here. Barb and I are here.
Okay, go ahead.
Okay, I'll start with the 8521 quarterly report, which was just completed. In the second quarter, April through June, we had 1,281 passengers that we transported on the bus for a total of 3,869 miles and 805 hours of service. As you see on the one line item, it's 362 people for nutrition, because our bus is still 2 times a week doing meal routes to deliver home delivered meals to the people in the Hayward area. So our numbers are there. Our costs are up for the bus. As the bus is aging, we are in the process of raising funds for the bus. We're close to $30,000 towards our new bus. We just received another $500 donation last week. So we're getting closer to being able to make some decisions about how we want to proceed with getting a new bus. Also in there is the meal counts for the month of May and June. I just got the ones for July today. Those will be put in tomorrow, but our numbers are increasing. Hayward, Stone Lake, and Exlin are open for lunch. We're still doing home delivered and carry out meals. Winter is still just home delivered and carry out meals. Just as everyone else is dealing with it, we're dealing with it at the Senior Resource Center. We have positions open in Hayward. We need a bus assistant. We have the possibility of one of our part-time bus drivers leaving us. We are working with someone right now that's job shadowing for the part-time bus assistant. We need a janitor in Hayward so that we can fully open when it's safe to. Stone Lake, we need an assistant cook in Stone Lake, because right now we just have one person there, with Carrie from Hayward going down to Stone Lake and helping at least one day a week for the breakfast rush, because she serves anywhere from 25 to 30 people every day for breakfast. The person that we had hired for the cook in winter has left us. So we still need a cook for winter, which could be an assistant cook for Exlin, depending upon what avenue we go there. But we definitely need an assistant cook in Stone Lake, Exlin, and winter. In the last several months, we've spent over $500 in ads in newspapers between Hayward, Winter, and Ladysmith, plus Facebook, Indeed. And we've had a couple applicants. We have 3 right now. 2 are not acceptable. 1 is, we're waiting to hear back from some of that individual's references to find out before we proceed with an interview. We're doing monthly fundraisers at the Senior Center, barbecue cookouts. We've got another one coming up on August 25th. This particular one is a special one. We had someone donate funds so that we could provide meals to the Sawyer County Sheriff's Department for those deputies that are on duty. the jailers, the Sawyer County EMTs stationed in Hayward, the City of Hayward Police Department, the City of Hayward Fire Department, the Town of Hayward Police Department, and the Town of Hayward Fire Department. As of today, all of the letters have started to go out with a list that they need to let us know if they want a burger or a brat, if they're going to drive through at the parking lot and pick up their meal. And our bus driver for those, like at the Sheriff's Department, the EMTs or other places, they will deliver the meals to those people that are unable to come and pick up their meal. We have a car show coming up on September 11th. That's a fundraiser. That's going to be at the Sawyer County Fairgrounds. We just got our signs, so I would imagine the fundraising committee will be getting the signs ready and out. We've been doing advertising. It's been on the radio. We have throughout the summer 2 Wednesdays a month doing bingo on the road down at Stone Lake at Schoolhouse Wines with an average of $800 would be our share on those Wednesday nights that we're doing twice a month. And that goes through, the last one I do is September 1st. So that's kind of in a nutshell what's going on, what's, been happening here at the senior center. If anyone has any questions, Barb and or I would be happy to answer those questions for you.
Are there any questions? Ms. Pettit, go ahead.
I want to talk about the Winter Senior Center.
Okay.
I've been inundated, and so is Mr. Big Buckholz, because it has not reopened. And I understand the situation. I've tried to relay that to my constituents. But you have to understand, when they see everything going on in Hayward and Stone Lake and nothing down on the southern end, it is very hard to make them understand that we are trying to get somebody in there. We're trying to form a committee, but it's not happening, and they're getting more and more frustrated. I have many individuals that do not drive. So somebody has to go down, drive to Exlin to bring it. You're talking about a year with senior citizens not being able to get meals. I have to do something. We have to do something for the southern end of the district. It's very disappointing, and it's very hard to say to my constituents, yeah, we don't have our senior center up, but you guys are having a barbecue in Hayward. This is what I'm up against, and Mr. Buckholz are up against.
One of the things that could happen down there, Dawn, is if people in the community would step forward and help us. We are delivering meals every day to Winter that someone picks up, one of our drivers, and they deliver meals to people. Anybody that wants a home delivered meals, they're on a route. We have very few people that want a carryout meal. We've had 2 previous cooks at that site that have left, and many days they've called Barb and or I or both of us in tears because of the way that things are going on down there. The community needs to help us. They need to help us find a cook. They need to help us find drivers. We do have an option in Winter of going to one of the local churches, which is the Zion Lutheran Church. They're more than willing to open up for us to come there. It's not going to be 1 day a week or 2 days a week. They're talking that they're willing to let us come there 5 days a week. It will be a situation where the meals will be delivered there. They can eat lunch, they can play pool, they can socialize, they can play cards, they can do whatever they want to do at that site. But in order for us to do that, we have to have a cook and we have to have community support. The reason that we're doing the barbecues and stuff in Hayward is because we have to raise funds to buy a new bus, and that bus is $108,000. I mean, when's the last time they've done a fundraiser? Excellent does fundraisers, Stone Lake does fundraisers. Stone Lake has people that walk in the door and hand Chris money. We have people that call here all the time and want to donate money, and we give them the options of all the things. And we tell them, if you want to donate, here are your options, and you put on your check or put in a letter what you want that money used for, and we'll put it there. We have not had anybody offer to donate anything to Winter in over 17 months or do anything for Winter in 17 months.
Well, and I think that that's because there's a bad taste in their mouth with it being closed. So Zion Lutheran Church is willing to cook and provide the
No,
meals?
we would cook the meals in Exlin and the meals would go up to Exlin and they would be served there. We do the same thing in Hayward at the Spider Lake Church so many days a week. The meal is cooked in Hayward. One of our assistant cooks, Marge, takes the food out to the Spider Lake Church and they're served out there. Right now, because of COVID and we all have little restrictions and things that we have to work with, Marge takes the meals out to Exlin. They're all packaged up just like it would be a home delivered meals. They meet in the parking lot. They pick up their meals. The church is willing to let them go in and eat, but until we get to the plan in our COVID plan for reopening, will the Marge go into the church and serve the meals in there? So we have, we have to live within those restrictions also. But the Zion Lutheran Church is more than willing. Barb and I and Brenda Adler, who is our rep for the winter area down there, we've all met with the Zion Lutheran Church about a month or so ago, or less than a month ago. So there are plans.
Right. You have to understand we're underneath the gun here because a lot of them are very upset. They're elderly. They feel that they're not being taken care of, and it is mine and Ron's responsibility and Mr. Kinsley's to represent them. And I'm not upset with you. I'm just trying to explain the dissatisfaction down on the southern end. And I have voiced that to them that everybody likes to say things, but no one wants to step to the plate. So if you got to put your money where your mouth is.
Exactly.
And I understand the position you guys are in. So I'm just trying to get answers and try to understand what is going on. So, and I'm sure I know they're probably all listening in because they were all going to listen to the meeting by Zoom, or several of them were. And I told them that it's time to come together and everybody work together, because I told them if you continue to complain, no one is going to want to work there, and no one is going to step to the plate to help them out.
Exactly.
And I understand it, and I appreciate the work you do, and it's not, I just trying to explain their frustrations. So,
I understand their frustration, but unfortunately, what they're not doing is they're not calling up here. I mean, there is only one person that honestly and truly has ever called this office and even asked any questions, and which is fine. I take that back. There's been two people, but unfortunately they don't understand. It's not that we're not serving them. It's not that we're ever not. They're always going to get home delivered meals. If we have to do carryouts, if we have to do it to the church, we're doing whatever we can do. But again, like you said, and I said, the community has to step up and they have to help us too, because we can't do it all by ourselves. I know one of the suggestions that we got was, well, maybe Stone Lake shouldn't do breakfast. Well, that's not going to solve the problem. In the month of July, they serve 303 breakfasts. There is no place in Stone Lake for the seniors to go for breakfast Monday through Friday. They can only go to bars, and they serve breakfast on Saturday and Sunday. So, and even if we did say, okay, sorry, Chris, you can't serve breakfast, that's not going to solve the problem in winter, because Chris she can't not serve breakfast, and then it doesn't make any difference. You still can't serve lunch in winter, because Chris can't go to winter and make up lunch and make lunch for Stone Lake too. So we just need help. And I mean, it's not just us. You can walk up and down Main Street in any place in northern Wisconsin, and everybody's looking for help. And unfortunately, we don't offer a very enticing wage because we don't have it in the budget to offer anybody 15, we can't offer $15 an hour. Our head cooks only get $12.43 an hour, and that's the max that we can do. And our assistant cooks get anywhere between 10, 50, and 11.
And I did bring that point up to them, because we have had several businesses here that had to shut because they didn't have enough staff to open. And I did bring that point up to them, and I told them they need to understand. But I think I might give you a call tomorrow and discuss some things, because I think I have some ideas for this area. Okay. Thank you.
All right. I will not be here in the morning, Dawn. I will be here in the afternoon after 1 o'clock, because in the morning I'm judging the educational fair for the Sawyer County Fair this weekend, but I will be in the office from 1 o'clock on.
All right. Thank you, Joe.
You're welcome.
Okay, does anybody else have any questions about senior resource center report? We'll move on to the admin of the litigation. So,
Yeah, thank you. As you know, our county and I think 70 or 71 counties of Wisconsin, as well as counties throughout the nation, have been in litigation against the opioid distributors and manufacturers. They have reached a tentative settlement or proposed settlement with the distributors and Johnson & Johnson. This was released in a press release just in late July, so this is relatively new. Just wanted to cover where we're at with it and what needs to happen in the upcoming days and months as this kind of winds its way down through the system here. It's a $26 billion settlement that's being proposed. Wisconsin's share of that would be about $400 million. And that would go to the state and the counties that are involved in the litigation if this goes through. Depending on the number of states and the number of local governments that agree to this, so we don't have an official amount yet for Sawyer County, but we are involved in the litigation and would receive funds if this proposed settlement does go through. So the funding overview, there's 3 distributors that would be paying up to $21 billion. This is over 18 years, so it's not just a one-time payment. You know, the county would receive funds over an 18-year period of their portion of that. And Johnson & Johnson's $5 billion total nationwide would happen over 9 years, but most of it coming in the first 3 years. So it depends on the participation, again, of state and local governments. It also depends on the allocation formula that gets used. And then they look at like number of deaths due to opioids, population. There's several factors that go into how they allocate the dollars coming into the various counties. This is kind of a busy slide, but it kind of gives you a kind of a flow chart of what happens to the distributors, 218 billion, and the Johnson & Johnson 5 billion, or I'm sorry, 21 billion and 5 billion, as it kind of gets distributed amongst those that are involved in this litigation. If you get all the way down to the bottom, there's a default allocation allotment. And the default, the subdivisions, which are counties, would get 15%, but there was recently legislation done in Wisconsin because in Wisconsin, counties are responsible for, you know, the treatment of addictions and those sort of things. So Wisconsin has passed legislation that counties would receive 70% of the funds, and the state would get 30% of the funds. If you recall back in the tobacco settlement, all that money went directly to the states and the counties didn't get anything directly. Here, the counties would get paid directly because they're the ones that are going to be responsible for doing a lot of the remediation and treatment from the opioid fallout. So next slide. Again, there's kind of an implementation phase. So this was just announced in late July. So step 1 is the attorney generals for each of the states have 30 days to either accept or deny this proposed settlement. And if they reach a critical mass, that is most of the states, there's a certain number of states in order for it to move forward. And if it did, it would go to step 2, which would be the subdivisions, which are the counties in Wisconsin. And we would have 120 days to decide if we're going to participate in the settlement, and then it moves along from there into a payment. So next slide. Again, you know, this kind of lays out the days. July 22nd was the day the announcement came out. So there, you know, that starts the clock on the 30 days for the states, 120 days then for counties, and then payments happen far down the line if everything goes through. So we could see money next year if everything goes according to the settlement being proposed. Again, I kind of talked about the state allocation. Wisconsin is listed as number 3. That legislation passed at the end of July as well, which pays counties 70% of that total that we would get, and 30% goes to the state. You'll see that's very advantageous as compared to what's happening in other states around the nation. 70% going to counties is by far a very generous portion going directly to us. So we will be able to address some of those needs that we certainly have in this county with some of these funds, should they flow our way. The next slide just has some other agreements as well. And then last slide, if you want more information, there's like a 300-page document that's on the National Opioid Settlement.com website, and you can read all about it. So we'll be hearing more about this as it kind of goes through the process here, and then the county can decide if they want to participate in the settlement or not in the future there.
Any questions?
Tom, Tom, do you think it's gonna be equally distributed amongst the counties? Or is it gonna be population based or?
Yeah, it's not equal. It is based on several parameters: population, number of deaths due to opioids. They had collected all that data in the beginning, so there is some formula for that. And so, we won't know that amount until, number one, they decide how many states participate and how many counties participate, and then they crank it through the formula, and we'll see a number at that point. Here's $50.
Any other questions? Health programs report. Tom?
The long-term care is first.
Yes.
Okay. Lori Perlick submitted a report for your review. I want to highlight a few things on there. The ADRC of the North hired a new dementia care specialist. And unfortunately, the ADRC of the North Hayward branch, our INA, that'll be information and assistance specialist, resigned. She's part-time and we're posting for that position. And then she also makes a note in there of the financial abuse isn't bad enough. There's complex financial abuse going on, and it's growing at leaps and bounds. And she indicated that it mirrors what's going on in the rest of the country.
What does that mean, complex?
Can Lori answer that?
Sure.
She's here.
Well, I would say when we do an investigation, we have to try and get the cooperation of financial institutions. From that, if we substantiate financial abuse, then we can make recommendations either to law enforcement or go directly to our DA to try and get prosecution. Typically, when we are building a case of financial exploitation, staff may be going through years of financial records to build a case to substantiate that abuse is taking place, how the money is spent, who is spending the money. So it takes a lot of hours to develop a financial abuse case. Sometimes we are seeing that it is a power of attorney for finance who is actually the alleged perpetrator. And we are having a lot of difficulty getting cooperation from law enforcement and the DA to prosecute these types of cases, because often the individual may have dementia, which is one reason powers of attorney for finance are appointed. And a lot of times we are told, well, it's just a he said, she said case. The person has dementia, so they probably did agree to it, they just forgot. They agreed to sign over their home to their child. They agreed to empty their bank account to this child who's a power of attorney. That was just their agreement. So it's very frustrating when, after spending hours, months on building a case, that we substantiate the financial abuse, but there is no prosecution of the alleged offenders.
Okay, I was just curious about the difference between a case and a complex case.
Well, the complexity is how long it takes to build a financial abuse case.
Okay, thank you. Long-term care,
Just did that, Ron, behavioral health.
I got it mixed up, behavioral health. Yes.
Alicia Carlson submitted a report for your review. I want to make a couple of comments. The first comment is something that it's not in the report. And that is, you may be aware that we have 2 youth justice positions open. In the meantime, Alicia, along with her staff, and Carla McKay, our CPS supervisor, have been triaging, trying to fill those positions, completing the work, which is equivalent to 75 hours of work. So I just want to recognize what they're putting in to help keep that unit going, youth justice. And the other comment I want to make is, well, it's kind of related to youth justice open positions. We posted for the mental health position, and we still do not have a candidate. And along those same lines, I don't know if I talked about this last month, and if I even knew about it, but we found out another caveat for CCS that is not in anybody's favor is licensed marriage and family therapists are not authorized to give mental health diagnoses, which really compromises us when we're trying to do the front end of the assessments and stuff. So, and that would be the one CCS therapist we have over at North Lakes. So we're really compromised, and these positions, again, like you've heard before, it's Sawyer County isn't alone. It's all over the place. And but I want to recognize that it's really putting extra work on our staff, and they're holding up so far, but it's really difficult. And then you also have the report in there that City Hannah's put together every month, and that's the mental health cost by client report. And I think she's projecting close to 1.5 million so far this year. Excuse me, I was remiss when I talked about the YJ coverage. We have Kathy Garby, one of our clerical persons that's really integral in helping us keep this thing together in the interim.
Protective services.
Okay, Carla McKay, our CPS supervisor, submitted a report for your review. It's just a summary of the caseload totals for her unit. Keep in mind that she is down a child protective services worker as well that we're trying to fill.
Anything on the substitute care report?
Yes, that you have your monthly report from Kathy Garby on the cost of care. And again, the RCC costs are trending towards where they were last year. I think for the Sawyer County placements, we were about $60,000 last year. I think total, and we're at 83 now. And then LCO, I think they were at 660 last year, and I think in the RCCs they're trending to about that total again. Replacement costs.
Yep. So, Mr. Chairman, I invited Bissum Rice, our ICW director for Lacuta, to come and just give a brief explanation of how our ICW works and how our ICC children are placed and monitored and evaluated. Bissum, is that okay, John?
So when Indian Child Welfare gets involved in families, it's usually after a report is made to Sawyer County Health and Human Services. We go through the initial assessment process. During that time, we determine if children need to be removed or not from their families. Most of the time, we are successful in keeping children at home with their families. Last year, from July to this July, we had 87 children who were subjects of investigations or initial assessments. Out of those 87, we only removed 7. One of them was voluntary. All of those children, except for the one voluntary, were placed with family members initially. So that's typically how we've been doing things. Once children enter foster care, they are evaluated for their level of need, level of care every 6 months. We also have a judicial review in court every 6 months to determine what's going on, update the court with progress. So sometimes those children require a higher level of care. So they have a lot of trauma that they're experiencing with their families. Historical trauma plays a piece in that. Other kinds of traumas do happen to our children. So we try to keep them at that lower level. Sometimes they do end up in like a group home. Sometimes those needs can't be met there. Sometimes they're in an RCC for evaluation for like overall psychological, how are they doing? Sometimes after that evaluation, then they end up with the recommendation that they should stay in that facility. When that happens, we do review their care plans. I think they go every 30 days or so. Every RCC does a review. We see how the kids are doing, how their families are doing. And we kind of determine when they can go down. So for right now, LCO has 5 children in RCCs, and 3 of those children will be going down into either treatment foster care with plans to move into their family home by the middle of September. So we'll only have 2 children in an RCC. Foster care, LCO currently has 11 in with 6 pending adoptions. So that'll be kind of where we're at now. And then Friday, we are going to have to put 2 more children into care, but that's because their families can't meet their needs anymore. They cannot provide for their family. So they have to end up in foster care. But again, we're going down with our numbers that are in out-of-home care. So we're only going to have 2 in RCCs. And then we'll still have the 13 that are in foster care, but we'll have 6 pending adoptions, and hopefully within 6 months, those adoptions will be finalized. So that's kind of how we're doing. I did bring some things for you guys to look at if you want to. One is the Title 40 foster care eligibility, because our kids are part of that 40 eligibility. Part of that is just how the county is recouping some of their money that they've spent, and it's not all of it, a portion of it that will come back. So this also goes in with our 161 agreement, and the 161 agreement is our financial agreement that talks about things that the tribe will do to help facilitate that 4E process. So there's judicial findings that need to be made. So the one that's going around now, and I apologize, I didn't bring enough for everybody, but that's just kind of the fact sheet on 4E. And this next one is the 4E program requirements that we have to make in tribal court hold on our orders so that those kids are eligible for that 4 reimbursement. And I think our tribal court has been really vigilant about making sure that we're making the correct findings at the appropriate hearings.
So to business, if they're eligible then for this Title 4E reimbursement, who gets reimbursed from that? And where does that money come from?
The county does, and that's coming
The county
down.
gets reimbursed.
Yes, from the federal government.
Do you have any questions? Go ahead.
My question is to Jason. How long are children typically in placement or foster care before they can be adopted?
Before they can be adopted, it really depends. Like, I won't move for permanency with a child before 15 months of passing. I don't say.
Is that a long process for the people who are adopting?
It can be. It can be. It's never our it's never the goal that we have. It's never to just have our children adopted. We prefer to reunify with family, and if that can't happen, we look at, is there possibility of like a guardianship with their own family members before we even consider adoption. And sometimes the adoption happens by family members.
Oh, okay. That's a good thing.
To business, is our 161 agreement, that's between the tribe and the county? Is that current right now, or is that up for?
That's current, and it will expire in February 22. So that's something that Paul, Carla, I, and all of our attorneys will be working on. I was hoping that we could start that before September starts, so that we're not waiting till the last minute to get it here, because it'll have to be approved by both the tribal council and this board.
So then, listen, what is kinship care then, and who funds that? Who gets that?
Kinship care is the money that is paid to family members, and the family members, that is defined by federal law, and it only extends to the second cousin or step great relatives. So it doesn't help if you have like a third cousin or fourth or something. Out here at Alceo, we recognize our family out very extended, like we'll say your sixth cousin is your cousin, we don't make that a limit. But we can only take kinship care funds to people that are second cousin or closer. So that money is pass-through money that we receive from the state of Wisconsin to do that, and it goes directly to those care providers. And it's a low amount, it's 254, and I think was it 300 they're gonna bump it up to?
Yes.
Yeah. Next year,
Per child,
per child,
per month.
per month. Not a lot,
Yeah.
doesn't go very far for kids.
That takes care of the protective services.
We just did that.
That was child protective
Yep.
services, okay. Economic support,
Economic support, Shauna White submitted a report for your review, and I'll just comment on the impressive numbers in the 99+ percentile on the work that they do in the call center and applications process and renewals process. What else? No, that's it.
okay. Somebody else? Must be hearing things. Budget post for purchase services gap, fleet review, is that up here?
There we go.
Oh, cool. COVID up.
Oh. I do need new glasses, people. Seriously, I do.
Okay, I think everything's up there. Okay, good evening. So I was hoping to not have a COVID update this week, or this month, but we've been getting a lot of calls and questions about what's happening. So I put something together that's a little bit more explicit than I normally put together. This is the data that we typically use from the Harvard Global Health. And I just wanted to kind of let people know where we're at. Yes, we have been seeing some higher numbers coming over the last week and a half. And at this rate, we are at 22.4 cases per 100,000. And that is a 7-day average. You can see back in the December, November, December, we were up at 135.6. We hope to not reach that again. I'm hoping actually that we would probably top out more on where those lower ones were at 37 and 43. So we'll watch that as we move forward and see how we do here. Lots of talk about variants, lots of concerns about variants, and I just wanted to go through what this really means. Viruses typically do make a change through mutation. So when it spreads from one person to another, viruses tend to create what's called a new variant of the virus. We expect that to happen, and we've seen multiple that have occurred throughout the world and in the United States since we first started having cases. One of the things that you can think about as a variant and what it would really mean is to think about it as a tree, and that's why the tree is there. So as you think about COVID, think of that kind of as an oak tree. As the branches spread out, those branches all look different when you look up at the tree, but it's still an oak tree. A variant, it's still COVID, it's just a variant of COVID. So that's kind of what that means. Now, when we start looking at them, they categorize variants into 3 different levels. They have variants that they have an interest in, which means that they're going to start watching it because of certain markers that they see with that. And they want to see if there's any change in how it transmits or how we diagnose things, how we treat it, or if vaccines are still working. So at this time, there are 6 that are being monitored. Then they move up to an area of concern. And so that's evidence that there's been some impact in something. So as we look at Delta variant and the B117, it was that the transmission rate was quicker. And you'll see some evidence of what we saw. And then they have variants of high consequence. That means that vaccines could be failing, or that we're no longer able to treat, or people are being hospitalized and more severely ill. We do not have any variants that are being monitored as high consequence. Back to these masks again, and I have to practice breathing in them. I got really used to not wearing them. Okay, so what we've been seeing, I just wanted to give you, this is that first graph that I typically show, and you can see that there were no variants of concern in Northwest Wisconsin that we were monitoring. About January, February, B117 started coming in. That was only 1.8% of what was being sequenced. By the time we started seeing that jump that happened in May, we started seeing that it jumped up to about 69% of the sequencing was the B117. And then as we moved into July, it was about 50-50 with the, in June, 50-50 with the Delta and the B117. And now that we're into July, it's 100%. So definitely are seeing that Delta has overtaken. And this is another slide that they kind of show you the differences here. So I think you can see on that screen, but I can't see on mine. So the dark reddish color, that would be B117. So you can see when it started coming that it eventually kind of took over the majority of the cases were B117. That light pink, my cursor is on there, that lighter pink color, that is what we're seeing the Delta variant is. And when you see the AY2 and the AY3, that is actually part of the Delta variant. It just looks a little slightly different, but it's still in the same context of that. And by the way, Delta is a lot easier to say, and why we kind of go with Delta than B16172. So when you see that little number up there, that's what that refers to. So this is what we're seeing. We're seeing that it's moving along. And then another way of being able to look at it, just to see the significance of what we were seeing with this. This was just on July 1st. Everything was looking pretty darn good. Across the country, we had a little bit of red. And then on the 15th, we saw a bit more red across the country. And by August 1st, this is what the community transmission looked like. This is why we're hearing quite a bit more about going back into COVID masking and different things. So one of the things, just to kind of let you kind of see what we were talking about when we talked about the Delta variant, one of the things is what they believe is happening, and more research is going to be coming out soon, that the spike protein, and that's that spike piece that comes off that we always see pictures of, on the end of that, it's this little pink thing here, and that's basically what is used to kind of connect to the cells, and that's what makes us sick. So this ACE2 that we see here is on the outside of our cells, and what they believe is happening is that the Delta variant is actually got better connection, almost think of it as like having better suction cups to connect easier. So it takes a lot less of a virus in if they're able to attach right away versus just kind of moving around and not attaching. So that's what they're thinking is why this Delta variant is much more infectious. So we're seeing it being 2 times more infectious than previous strains. When it comes to more severe illness, they're still watching. It's really too early for us to be able to tell that. When we're looking at vaccine effectiveness, remember that these are some of the things that we're looking at in moving something from an interest to a concern. We are seeing that vaccine is still really effective. Only about 2% of the cases actually have been fully vaccinated at this point. And we definitely are seeing less illness and, less hospitalization and death when that does occur. So that does tell us that the vaccines are working, because we know vaccines are not 100%. We kind of anticipated about 94%. So that's letting us know that. One thing that you don't see a lot on out in the literature is the acquired immunity, or if you have an infection already. But we talked about that, and we know that that's part of our herd immunity, is people who have already been sick. So there's not a lot of literature in it, but what we've been hearing about is that it does look like we are having effective immunity if there was a previous illness there. I haven't seen really hardly any reinfections, so that's a good news. And then I usually use the global health, but because the CDC came out with the updated guidance on masking, which said that when you're in the community transmission rate of substantial or high, when you're indoors in public places, both vaccinated and unvaccinated people should be masking. I have brought out this additional data source so that it makes sense for people. This is what they base that data on. And so we have had quite an increase in cases over the last week, which is why I put out last week that we were having more in a steady substantial rate. We did jump into high. Looking at it now, I'm thinking we're just going to be kind of bordering on high and substantial for the next week or two, depending what happens over the next couple days in cases. We'll be able to know a little bit more where we're going. And then the final thing, just wanted to show, because we always talk about how many people are vaccinated in our county. And so I'm using the CDC data. It's slightly higher than what the Wisconsin data is. And that is due to the CDC data also has the federal vaccine data in it. So if somebody got vaccinated at a VA or some federal government, they don't have to put the vaccine data into Wisconsin registry. It would just go into a federal registry. So CDC can combine the two. So it's about, I think it's 1 or 2%, depending on when you look at it, difference, but this is what this data is. So we are looking at about 48.7% of our entire population is fully vaccinated, and close to 56% 12 years and older. And then on the bottom, just to kind of bring in, well, what could we potentially say? We have for immunity with previous infection. I just took our cases that we had and subtracted about 40%, thinking that potentially 40% of those people have been vaccinated already. I don't have that data, so this is just a number to kind of look at and kind of get a potential. So, so really we're looking at, between 55 and 60% as fully having immunity. So that's where we're at. We won't be mandating masks. I'll just be following what the CDC guidance is as we move forward, making sure that that's on our website. People know where we're at. Schools will be making their decisions with their school boards as we move forward. And we'll make masks available for people. And that's what I've got for you tonight. A lot of detail. Yes.
Will you be doing the same contact tracing and everything as you have been?
Yeah, nothing has
Nothing
changed
changed,
as far as contact tracing goes. And actually, good question, because there are a lot of counties that are really hurting right now on that. We were lucky enough that most of our contact tracers are either retired and picking up part-time work with us, or are just taking on additional work and have full-time jobs. So they've just kind of been hanging out and laying low, and now have picked back up for us. So thank you.
Julie, what are your thoughts on that booster vaccine that Lorraine mentioned? They're coming up with their testing, or?
They're looking at the booster vaccines. At this point, they aren't showing that they're going to wait until we start to see that vaccinated to determine when their antibodies start to go down. There are studies also for people who have acquired immunity, and you don't see as much of that out there either, but we had asked our state medical director, and he did say that that's still looking good as well. So.
What are the ages of your recent positive cases?
Oh, you know, I looked through on a longer version, and the higher case stuff is between 13 and 39 is where we're kind of seeing the quality of now.
And were those cases unvaccinated? I'm sorry if I missed that.
Yep. We have had some, less than the recent ones. We haven't seen any vaccinated ones, but we have had vaccinated cases get the virus, get infected after they've been vaccinated. It's been of less than 2%.
We're trying to have some kind of normalcy in our lives again.
Yes.
And so we keep encouraging to get vaccinated. I know one of the tribes out west, they mandated, you work for our tribe, you get vaccinated because they're protecting their children.
Yeah.
So that's where some of the tribes have moved.
I can say too that our clinic today was actually pretty full. So, and I've been hearing that in the last week or so, people have been jumping on board and coming in. So.
Yeah, we're trying to save lives.
Go ahead.
Julia, symptoms are the same as the initial COVID,
We really
just not as severe. And I was going to ask you, doctor, how was the hospital looking for staffing? And
We're okay. So at this point, we have had an increase in COVID cases. You know, we have a trickle through. We had a 17-year-old recently that was admitted for COVID-related illness, but so far so good.
I'm hoping that we see this ride through this, kind of like we had in the past, that can kind of go through to like this slide here. And you can see that some of these peaks don't last real long. So we'll hope that that really is the case for this. And we'll just watch and see how things go. We always get a little nervous when illness spikes around the time of school starting. So, and that's when we start getting more people in one building. So we'll be watching closely to see what happens and work as best as we can with the school.
Okay, any other questions for Julia? Okay, everybody has their budget performance report. Services recap.
We do a Patty here now, so.
Can I ask Patty a question?
Like I said,
Oh, then I would ask. Did you win?
Well, I know I didn't win $52,000 because for the minutes, I won a $50 certificate to the landing. So once I won that, I knew that I could come to the board meeting because I didn't win $52,000.
She was at the WRLS.
But that was lucky.
Yeah.
So I am lucky, but. Any questions?
well, can you give us your comments on this budget report? And are we tracking where we thought we would be, or?
Well, that report shows through June. The report that, the bills that we just got done are through July that we just finished, but the report that you have is through June. And no additional comments. It's pretty much staying status quo as to what I've said in previous months. Where we did have one person in Winnebago and one person that had been long-term out, they are both back there again. So we'll see how that.
you want to talk about the fleet?
Your purchase service recap will also goes along with that. That basically goes along to prove what your the county car report. You can see that what our savings were. Our savings were 5,670.15. And when I thought I wasn't gonna be here because it was gonna be a big winter tonight,
Yeah.
I had done this for Paul, where I went back to 2019, the last pre-COVID year, when we were actually using the fleet and going out and seeing people. Because if you think of January through June, we didn't even start going out and seeing people in their homes until May. So this is kind of, although that's a huge savings. In 2019, we had twice the miles, 56,029 miles. The cost was almost the same, 4,623. And the savings was $14,412 for the same period. So the more you use the vehicles, the more economical it is for us too, and the more the savings are.
And the gas price difference too.
Well, there's two things that put into, the gas price went way up, of course, compared to 2019.
Mileage.
Yeah.
And also, the cost that we were charging internally for the sanitarian and water program. We were charging initially 0.525 cents a mile, the county rate. And then in 2020, we started charging 0.425, the county employee rate. So that made a bit of a difference too into what, but that's still, the number of miles is less than half from 2019 in the same period. I didn't bother doing 2020 because that would also have skewed. But anyway, it's still, you can see that it's a savings, anything in the right direction.
Mr. Chairman, I just got a real quick question for Bissam. Do we pay our workers, social workers that go out mileage when they do home visits?
Yeah, we pay the federal rate 0.545 a mile. And then we do have one vehicle.
That we share?
Well, my department has one. So we haven't really had a whole lot of mileage in the last month or two since we got it.
I think another saving is when we hire social workers, we used to have to travel to all these trainings. Now the trainings are over Zoom, so they don't have to travel for that. I don't have to travel for meetings, I go over Zoom. So that's a huge saving. I think.
Yeah.
And if I can just piggyback onto that, us northern counties, for both the health and human services, are really pushing the state to continue to offer that because everything's so southern centric
Yeah.
in Wisconsin, and it is, not only does it hurt us in mileage, but we're the ones that have to be gone from here for a day or two longer than anybody else, and we don't have the staffing that they do. So we're really trying to advocate to still allow us to do this.
That's an acceptable closed session.
Well, we do have 2022 budget item 2.
Say something more.
I do, actually. Since we had all that good news, I'll start in on the 2022 budget. We did have the presentation that Patty gave, Patty and Paul, last couple of months. And nothing's changed on the Health and Human Service budget on that yet. As you know, we still do have the problem with the out-of-county placements on the mental health, behavioral health issues. So that is still a major concern, not only in this department, but as the county as a whole and how we fund that. In looking at the rest of the county, we've gotten just about all the department budgets input now. In total, we're about 1.8 million over what we can spend on the operating side. That's if you're looking at totally funding the mental health issue. We realize that we don't have that totally budgeted within this budget. If we did, we would be about a 1.8 million below what we can spend. The other bit of bad news is our new construction. We decreased. It didn't decrease. It had a lower percentage of increase than it did the prior year. So we still had an increase, obviously, in net new construction, which is where we get our operating levy allowance from. And so we get about $600,000 more levy this year than we did last year due to that net new construction. So out of all the county operations that we have to do, we get another $600,000 to fund that. You know, as you look at countywide wages, health insurance, other costs, utilities, other costs that have increased, you know, that $600,000 doesn't go too far. In addition to fully funding those mental health issues, you know, that's where we've got work to do to close that budget gap, which we'll be, you know, looking at over the next couple of months so that we can get a budget passed here in November. So we're not out of the woods by any means yet, and we probably will need to have more discussions about, you know, the services provided not only in health and human services, but throughout the county, you know, as we look at filling that gap. Fortunately for health and human services, over the past, you know, 5 or 6 years, we've had an increase in fund balance. That is, we haven't spent as much as we took in income or had budgeted. So that fund balance in health and human services had increased over the several years, except for last year. Obviously, we did take a big hit to that fund balance, and we will continue to do so unless we either find a different funding source or severely cut back on services. So you've heard that broken record before, but here it is again.
How's the sales tax?
Sales tax is way up. We're setting records every month on sales tax, which is helping us tremendously. You know, we get our revenue sources for the county generally are, the bulk of it is property tax. That's set in stone. Our other ways to get revenue is sales tax revenue and our forestry stumpage revenue. Both of those are fortunately keeping us relatively in the game here, but a change in economic conditions and our sales tax goes down, and then we're really hurting. So we can't live on increases in sales tax, obviously, but we do have an increase budgeted, and that's included in the budget numbers. We're still, you know, that much.
Tom, will this opioid money get us in time for 22? And do you expect, what would you expect from that anyway?
We don't have a dollar amount. We probably will see money in 22. So that might help us. You know, it's another one of those things like ARPA where you've got money to spend, but you've got to spend it on certain things. And depending on whether you need to do it on new services, you know, you can't supplant what you're doing now with the new money. You might have to do additional things, which we would probably want to do with that money, because that does help us, you know, help alleviate some of the costs we have, you know, through the treatment and the court system and the sheriff, and it just permeates through all of our budgets if we can get that whole thing under control within our lifetime or somebody's lifetime.
So has there been a lot of money funneled down to the county?
For ARPA, yes, we got 3 million allocated, of which we've received half of that now. So, you know, that ARPA money can be used for specific purposes. Not much of that, if any, can be used for behavioral health issues, however. But to finish answering your question, you know, we've got that opioid money coming due, so it's not in the budget now because we don't know how much it is and how we can spend it. We've also got that TAD grant that we would be applying for this fall that would also help the behavioral health situation, but that would also be, you know, new programs, new diversion programs, treatment programs, but it would help fund those things that theoretically then will help the rest of the cause. So we got a couple of kind of moving pieces here, as well as just the regular operating budget.
Add some to that.
No, you can say that.
I don't want to be a buzzkill this, but my concern is that with this opioid funding, as with a lot of these grants that come out, it doesn't supplant the existing costs. It's usually some creative type of programming. And if you have creative type of program, you're probably going to need more staff. And we're having a hard time filling the staff positions we have right now. So I don't know how practical it is to do that. and it's something we're gonna have to face, but I don't think it's a slam dunk. It's reality.
Yeah, the reality on the labor shortage, it hits us as well, especially in these specialty positions where we need, credentialed individuals to do some of these things. But we had one department, a different department, ask a question in HR today. It's like, how come I only got 3 applicants for this job I have posted? And it's like, you're lucky you got 3.
Get some other one. You did good.
Yeah, we don't normally see that. Usually you go 3 months with no applicants, not 3 applicants in a month. So, you see those help wanted signs everywhere. We've got them here too.
Okay,
Very good, Tom.
Yeah.
with justice. Motion to go into a closed session. So moved, Mr. Chairman. Second.
Thank you for coming.
Motion by Mr. Wilson, second by Mr. Schuman.
The Bissell. I'll call you in the morning. Thanks for coming.
Tom, do we have to read that? Do we have to read that when we go to closed session?
Yes.
What else you do?
You know, am I reading that?
Yeah, it is.
In the glasses.
Mr. Chairman, move to move into closed session pursuant to Wisconsin statute, section 19.85, parent 1, parent E, for the purposes of deliberating or negotiating for the purchasing of public properties, the investing of public funds, or conducting the other specified public business.
Second.
Favor say aye.
Aye.
Anybody opposed? Motion passed.
I think they've been talking, I'm not sure it's all been.
So,
Yeah. Yeah, we do. We even do the detox. We send them all over to Chippewa, or wherever we would send them for the detox. We could be doing it here. No, that's up to the individual, yeah. Part of them.
okay, since we're on a closed session, we can have one more motion on it's on to the county board or how to pass it on.
Mr. Chairman, I would move to accept the termination of the memorandum of understanding with Northwest Passage in the county and forward that to the county board for ratification.
Second.
Any further discussion or questions? Everybody in favor, say aye.
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 Motion passed. We're adjourned.
Thank you, everyone. Thanks, Lorraine.
Take care, Don. I'll get back to you.
Okay.